Meet Paco and Ann, a lovely couple from Zone Tambis of Barangay Pacman. They've been dating already for only 6 months, when Paco bent the knee and asked Ann for marriage during their monthsary. Of course, Ann happily said yes, and immediately wanted to plan their wedding ceremony. Paco and Ann are avid believers of YOLOing through life, making their every decisions on the whim, leading a life of pure spontaneity. So they were unsurprisingly clueless on the things they have to do before entering the life of marriage, as a prerequisite in securing their marriage license. Paco and Ann reluctantly attended a pre-marriage counseling offered at their local DSWD, and went to their local health center for the Responsible Parenthood and Family Planning Seminar. While waiting for the seminar to start, a certain TV commercial caught them off guard.
Isang taon pa lang ako, nasundan na ni Toto. Grade 2, 8 taon pa lang, 4 na bata ang inaalagaan. Grade 6, 12 na ako, kasing dami na ng pamilya ko. Sabi mo, pasensya na, walang pera kaya mag-drop out ka. Inakup, sabi mo kami mahal nyo, ari ko pati kayo nagplano. Sana hindi gutom at nag-aaral pa, alaga't malusog ang buong pamilya.
Ang planadong buhay ay maayos na buhay.
After watching the TV commercial, Paco and Ann reacted differently. Paco just laughed it off, thinking it was too absurd to become reality, while Ann seemed worried about their future life, feeling unprepared for what is yet to come. Ann was somewhat annoyed by Paco's reaction, while Paco just keeps teasing her for being so worried for no reason.
A few moments later,
Paco and Ann got into a fight. Paco blames Ann for being too caught up by that TV commercial, while Ann blames Paco for not taking her reaction seriously, and told Paco to start thinking about their future family life. But Paco insists that they just have to take things the YOLO way like they used to. This resulted to Ann storming out of the waiting room. On her way out, she bumped into Dr. John, who was on his way to meet them for the family planning seminar. Dr. John noticed that Ann seems to be upset, so he asked her about it. Ann confided that Paco seems not to care about the importance of planning their family, and she's also worried about their future family life. Dr. John offered to help and asked her to let him talk to them. So they went back inside the clinic hoping to resolve the issue. The couple then decided to talk with Dr. John. He shared to them that entering marriage is not like a one night in Vegas. It entails responsibilities to both your partner and to your future children. Dr. John emphasized the importance of family planning, especially to couples who are starting their married life. Family planning will help them get off on the right foot towards their future. He then presented to them a video presentation to help them understand, especially Paco, the importance of family planning.
Sabik ka na bang makasama sa isang bubong ng iyong asawa? Magtayo ng tahanan? Magkaanak? Magkapamilya? Maghunos dili ka muna. Baka masira mo pang lahat para sa iyong mga minamahal. Dito ka muna! Family planning. Ano ito? Ang family planning o pagpaplano ng pamilya ay ang kusang loob at mapaniyak na pagsasagawa ng mag-asawa na magkasamang pagpasyahan at pagplanuhan ang bilang ng kanilang magiging anak, kung kailan magkakaroon ng isa pang anak, kung gagamitin ang responsable at legal na pamamaraan upang makamit ang ninanais na bilang ng mga anak o humingi ng tulong upang magkaanak. Ang family planning ay hindi lamang ukol sa mga contraceptives. Ang layunin nito ay nasa kakayahan ng mag-asawa na tiyakin ang kapakanan ng pamilya sa pamamagitan ng pagkakaroon ng wastong bilang ng mga anak ayon sa kanilang kakayahang pinansyal, psikolohikal at pisikal upang makamtan kung ano ang pinakamahusay para sa buong pamilya. Maraming mga pag-aaral na sinasabing karamihan sa mga pagpanaw na may kaugnayan sa pagbubuntis at panganganak ay sanhi ng hindi ginustong pagbubuntis, sanhi ng hindi pagkamit sa pangangailangan ng family planning. Kaya ano nga ba ang pakinabang ng family planning? Ang mag-asawa ay maaring magkaroon ng mas maraming oras sa bawat isa ng may pagmamahalan at pagsuyo. At sa mga pagkakataon, para sa sarili at profesional na pag-unlad. Sa ina, ang masyadong maraming pagbubuntis at panganganak ay naglalantad sa mga ina sa mas maraming komplikasyon. Wastong agwat at tamang bilang ng mga anak ay nakatutulong na matiyak ang kalusugan ng ina dahil siya ay mayroong sapat na panahon na mabawi ang kanyang kalusugan matapos ang panganganak. Sa ama, magagawa ng ama na may bahagi sa kanyang asawa ang responsibilidad sa pag-aalaga at pagpapalaki ng kanilang mga anak na sulit din sa panahon at makapagbibigay pa ng higit na libreng panahon sa ibang mga gawain para sa kanyang pansariling pag-unlad, kabilang na ang paglahok sa mga aktibidad na pangkomunidad. Sa mga anak, ang bagong panganak na bata ay magiging mas malusog. Lahat ng mga anak ay magkakaroon ng sapat na suporta, pagmamahal at alaga at iba pang pangangailangan nila mula sa mga magulang. Karamihan sa mga desisyon at kagustuhan ng mga lalaki ay nakakaapekto sa gawin ng kanilang mga asawa o kinakasama ugnay sa fertilidad. Halimbawa, karamihan sa mga lalaki ay mas nais ang mas maraming anak kaysa sa kababaihan. Kadalasan, ang kagustuhang ito ay naigigiit ng mga lalaki sa kanilang mga asawa. Nasa atin man o hindi, itigil natin ang saloobin na ang ating mga asawa ay dapat sumang-ayon na lang sa pagtatalik kailanman natin naisin. Magsasanhi ito ng hindi inaasahang pagbubuntis. Kailangan nating dumalo sa mga programang tumatalakay sa family planning at upang malaman kung paano tayo makapagbibigay ng suporta sa ating mga asawa bago o pagkatapos ng panganak. Ugaliin, makipag-usap sa ating mga asawa at magkasamang itakda ang mga layunin ukol sa pag-aanak. Galangin natin ang mga pasya ng ating mga asawa. Marapat na alam natin ang ating kakayahan sa pagkakaloob sa pangangailangan ng ating mga anak at pamilya. Lagi nating itanong sa ating mga sarili, kakayanin ko pa bang may taguyod ang isa pang anak? Tayo'y maging huwaran sa ibang mga lalaki, lalo na sa mga mayroong maling pagkakaunawa tungkol sa pagpaplano ng pamilya. Ang mga lalaki ay maaari ding maging buhay na katibayan sa mga pakinabang ng pagpaplano ng pamilya.
The video presentation seemed to lighten the mood of the couple. They became more interested in family planning. Even Paco started showing interest in family planning methods and asked about different means of contraception. Dr. John continued with his presentation on the different family planning methods to answer their questions.
Ano ang mga iba't ibang uri ng family planning? Maaari nating ibahagi ang mga uri ng family planning sa tatlong pangkat. Una, narito ang mga sumusunod para sa likas na paraan sa pagpaplano ng pamilya. Billings Ovulation Method, Basal Body Temperature Method, Symptothermal Method, Standard Thermal Method, Standard Days Method, at Lactational Amenorrhea Method. Mayroon din tayong makabagong paraan sa family planning, tulad ng pills. Naglalaman ng mga hormones ng iba't ibang kasukat na sa pakete na may 21 o 28 pills na maaaring inumin ng isang beses sa isang araw. Gumagana ito sa pamamagitan ng pagpigil sa ovulasyon o pagpapakawala ng itlog mula sa ovaryo, nang sa gayon ay maiwasan ang pagbubuntis. Injectable. Naglalaman ng sintetikong hormones at progestin na itinuturok sa braso o sa pigi na nagpapakapal sa cervical mucus at nagbibigay hadlang sa pagdaan ng similya. Intrauterine device o IUD. Isang maliit na plastik o aparatong metal na ipinapasok sa loob ng matris o bahay bata para mapigilan ang pagbubuntis. Implant. Isang maliit at madaling nababaluktot na tubo na ipinapasok sa ilalim ng balat ng braso ng isang babae. Condom. Manipis na upak ng gomang latex na isinusuot sa nakatindig na ari ng lalaki upang harangan ang pagdaloy ng similya at sakit na nakukuha sa pagtatalik o STD sa ari ng babae. At para naman sa mga mag-asawang nakapagpasya ng hindi magkaanak pang muli, ibinabahagi namin sa inyo ang permanenteng paraan sa pagpaplano ng pamilya. Pero teka, pagpasyahang mabuti sa paggamit ang pamamaraang ito sapagkat ito'y hindi na maaring maibalik pa sa dati. Bilateral tubal ligation o BTL o female sterilization. Ito ay ligtas at payak na operasyon na may kasamang pagputol o pagharang sa dalawang lagusang itlog o fallopian tube na nagdadala sa itlog mula sa ovaryo patungong matris o bahay bata. Vasectomy o non-scalpel vasectomy o NSV. Isang permanenteng paraan sa lalaki na kung saan ang vas deferens o tubo kung saan dumadaloy ang semilya ay itinatali o pinuputol o hinaharangan. Palaging tandaan, ang pagpapasya ukol sa paggamit ng mga pamamaraan sa pagpaplano ng pamilya ay dapat parehong napagkasunduan ng mag-asawa.
Paco and Ann learned a lot of new things about family planning. Dr. John's inputs gave them a feeling of assurance that if they stay educated about these matters, they can achieve the future they wanted for their family. After the seminar, Paco and Ann said their goodbyes and thanks to Dr. John for giving them a very enlightening talk on family planning. Now, the couple feel more prepared for their future family life. Equipped with their new learnings on family planning, Paco and Ann are now ready to take on their new challenges as soon-to-be-wed couple and move towards their future marital journey.
The National Family Planning Program. The program envisions for the Filipino women and men to achieve their desired family size and fulfill their reproductive health and rights for all, with universal access to quality family planning information and services with the context of responsible parenthood and informed choice in order to achieve population outcomes that are facilitative of economic growth, in line with the Department of Health Formula 1 Plus strategy and Universal Healthcare Framework. The National Family Planning Program is committed to provide responsive policy direction and ensure access of Filipinos to medically safe, legal, non-abortifacient, effective, and culturally acceptable modern family planning methods. The program specifically aims to increase the modern contraceptive prevalence rate among all women from 24.9% in 2017 to 30% by 2022. So what is contraceptive prevalence rate? Contraceptive prevalence rate is the percentage of women who are currently using or whose sexual partner is currently using at least one method of contraception regardless of method use. It is usually reported for married or in-union women aged 15 to 49 years old and is computed using this following formula. The contraceptive prevalence rate in the country improved in 2011 to 2013, but progress was reversed in 2015. The low contraceptive use was partly due to the weak family planning service delivery network and the lack of nationally led advocacy campaign. The program also aims to reduce the unmet need for modern family planning from 10.8% in 2017 to 8% by 2022. Women with unmet need are those who are fecund or sexually active but are not using any method of contraception and report not wanting any more children or wanting to delay the next child. This performance indicator is computed using this following formula. With the reversal of progress of family planning initiatives is the consequent rise of unmet needs. Unmet need is especially high among groups such as adolescents, migrant, urban slum dwellers, refugees, women in postpartum period, and those with low educational background. Now let us proceed to the program components of the National Family Planning Program. The first component is the provision of free family planning commodities that are medically safe, legal, non-abortifacient, effective, and culturally acceptable to all in need of the family planning service. Under this component is the forecasting of family planning commodity requirements for the country. Forecasting is the process of determining the commodity requirements, either supplies or services, for all current users and potential clients with unmet needs. The supply and budget allotments shall be based on, among others, the current levels and projections of the following: the number of women reproductive age and couples who want to space or limit their children, contraceptive prevalence rate by the type and method used, and the cost of the family planning supplies. Presented in this slide is the projected cost of family planning commodities from 2017 to 2020. Looking at the total cost of family planning commodities per year, you can see an increasing trend. The projected costs take into account an annual inflation rate of 2 to 3%, the average usage rate of each commodity for the 4-year period, and a buffer stock of 10% for every commodity. After forecasting, the procurement of these commodities commences. Procurement is the process of acquiring commodities from suppliers at affordable prices and ensuring the procurement requirements to safeguard its quality. The Department of Health shall procure, distribute to LGUs, and monitor the usage of family planning supplies for the whole country, and shall coordinate with all appropriate local government bodies to plan and implement this procurement and distribution program. In the same table a while ago, you can also see the number of units of each family planning commodity necessary to address the projected family planning need per year. The last strategy to ensure the provision of free family planning commodities is to strengthen the supply chain management in FP and ensuring an adequate family planning supply at the service delivery points. This process involves determining how much and where the various commodities and services will be placed to make them available at different target clients. The second component of the National Family Planning Program is the demand generation for community-based management information system. This system involves the collection, processing, and analysis of the program-related information essential for policy making, planning, and designing interventions appropriate to the needs of the target clients. The Family Planning Information System must be established at each level of operation, and at the community level as well. The first strategy of this program component is the identification and profiling of current family planning users and identification of potential family planning clients and those with a net need for family planning. The aim of management information system is to generate a timely, accurate, and complete set of information as a ready reference for health facility managers and staff when they make decisions to improve the delivery of family planning services. This strategy mainly employs the efforts of the primary healthcare workers like the barangay health workers, the community health teams, the rural health midwife, and the public health nurses to do the target client and master listing profiling with the aid of the several recording tools for documentation. With the differing circumstances at the community level, several novel strategies of searching for unmet family planning needs and unreported family planning users are also employed, some of which is the partnership with private family planning commodity providers to help keep track unregistered family planning users. This will help keep accurate family planning service data. The next strategies under component are the mainstreaming of family planning in the regions with high unmet need, for FP, the development and dissemination of information, education, communication materials, and the advocacy and social mobilization for family planning. These approaches can be addressed by doing some of these following activities. Mainstreaming of family planning in areas with high unmet need can be done by doing an FP caravan in cooperation with several stakeholders. Services may include family planning health education, counseling, enrollment, and family planning service provision. Family planning information dissemination can be done by doing usapan sessions during pre-marriage counseling, mother's class, postpartum visits, or even in antenatal care. IEC materials were also instrumental in conveying the positive message of the family planning program. This includes brochures, flip charts, infomercials, or any multimedia. Advocacy and social mobilization for family planning can be done during family development sessions, barangay assemblies, where most of the target clients are present. These acts will give opportunity to educate the public on the importance of a family planning program. To summarize, demand generation typically follows this structure. It begins with the identification of the client pool and the target clients, ending with the family planning service provision with proper documentation. The third component of the National Family Planning Program is family planning in hospital and other healthcare facilities. In establishing FP service package in hospitals and other health facilities, the following are important requirements that should be fulfilled. First, appropriate health service infrastructure in an enabling environment. Second, adequate committed and competent staff. And lastly, availability of standard equipment, health products, and other logistics. The following table summarizes the FP services delivered at each level of health facility. The recommended minimum requirements are also specified. We can see here that the primary health care, custodial care facilities can provide family planning counseling and education, risk assessments, management of minor side effects, and referrals, and most of the family planning commodities exempt PTA. These services can be given provided that the staff are trained and basic equipment is present. As you can see in the table, as the level of health facilities increase, so does the number of FP services it can provide. Most of the additional services of the higher facilities are more complicated procedures and management that requires more training and related resources. The next strategy is the organization of FP itinerant team for outreach missions. These correspond to the specialized outpatient FP service that provides the same FP services of primary healthcare facility, plus non-scalpel vasectomy and bilateral tubal ligation. Most of these outreach missions are done to deliver family planning services to the poor communities, especially the geographically isolated and disadvantaged areas. Another aspect of this component is the provision of budget support to operations by the itinerant teams, including logistics and medical supplies needed for voluntary surgical sterilization services. And lastly, making FP services as part of the medical and surgical missions of the hospital and partnership with LGU hospitals for outreach missions. The last program component of the National Family Planning Program is the financial security in family planning. Resources have never been adequate to meet the full requirements of quality FP service delivery in any given health facility. Most FP services are hardly funded from the regular budget allocation for health. Strengthening PhilHealth benefit packages for family planning is one of the strategies in establishing sustainable financing schemes in support of this program. Presented in the table are the different case rates for several family planning services covered by PhilHealth. These benefits can be claimed provided that the user is a PhilHealth member. This implies that this strategy calls for continuous enrollment of indigents to PhilHealth so that they can enjoy these FP services. This reimbursement scheme also encourages health facilities to push for accreditation to become a PhilHealth freestanding family planning clinic. These clinics are qualified to provide and claim for the following benefit packages: IUD insertion, subdermal contraceptive implant, and no scalpel vasectomy. These following accredited healthcare institutions are also qualified to provide family planning benefit packages subject to additional requirements, particularly training. The next strategy of Component D is the social marketing of family planning services. This is designed to create social change by reversing misconceptions through media campaigning. Fear of side effects remains to be one of the leading reasons why women do not use contraception in the Philippines. Hence, promotion of family planning will entail the development of effective messages and communication strategies aimed at behavioral change to reverse the fear of these side effects. The last aspect of this program component is national subsidy and funding. The government's efforts to realize this strategy can be summarized in the Philippines Family Planning 2020 commitments. Commitment 1. The Philippines will establish a national policy on reproductive health and population development and allocate funds to implement the policy. The issuance of the Philippine Republic Act No. 10354, also known as the Responsible Parenthood and Reproductive Health Law in 2012, is considered as a landmark legislation in the country's law-making history and has laid down the foundation in achieving reproductive health and rights of all Filipinos. The government acknowledged the full implementation of the RPRH law as an essential policy measure in achieving the targets set by the Philippines in the Sustainable Development Goals 2030 and Ambisyon Natin 2040. As a result, President Duterte issued Executive Order No. 12 entitled Attaining and Sustaining Zero Unmet Need for Modern Family Planning through the strict implementation of RPRH law in January 2017. The order intensifies and accelerates the implementation of critical actions necessary to address the unmet need of Filipinos for modern family planning. The order also directs all executive agencies to allocate resources and solicits support in this initiative. Commitment 2. As of 2017, the Philippines commits to $78 million for commodities, demand generation activities, contraceptive security, policy development, advocacy, and mitigation of the TRO and partnerships with CSOs and private groups. With this allocation, the Department of Health hopes to provide FP commodities free of charge to all women and men of reproductive age following the principles of informed choice and voluntarism with preferential access to the poor. And lastly, Commitment 3. The Philippines commits to provide family planning services to poor families with zero copayment and to upgrading public health facilities and increase the number of health service providers who can provide reproductive health information. The Philippines will work with partners to provide information and training. The partner institutions are as follows: non-government organizations, local government units, civil society organizations, church or faith-based organizations, development partners, and the private sector. Presented in the slide are the specific government agencies involved with the National Family Planning Program. Next are the civil society organizations. And lastly, the multilateral donor agencies. To review the 4 program components of the National Family Planning Program, first is the provision of free commodities for family planning that are medically safe, legal, non-abortifacient, effective, and culturally acceptable to all in need of the FP service. Second, demand generation through community-based management information system. Third, family planning in hospitals and other health facilities. And last is the financial security in family planning, using these identified prioritized areas as their focal strategies. First, the conduct of family planning outreach missions. Second, strengthening of the modern family planning services for postpartum women in hospitals and birthing facilities. And lastly, demand generation activities to identify women, including poor, adolescents, and marginalized populations with a met need for modern family planning method and link them directly to the FP service delivery. The Family Planning Program also recognizes several barriers to its implementation. The most common reason of FP unmet need in the Philippines are the health concerns about contraceptive methods, including their fear of side effects. The second largest reason of FP unmet need is that many women believe that they are unlikely to become pregnant because of sex infrequency, temporary infertility while nursing, and being less fecund than normal. The cost of contraceptive supplies has also become a more common reason for non-use in recent years. The switch to private sector suppliers is likely to involve higher costs, and lead to reduced access, particularly for low-income women and couples. Other reasons for non-use of contraception are the opposition by women, their partners, their families, or religion, which is a decreasingly important factor now in the Philippines. Other factors are as follows: the cutbacks in family planning funding, both from public and private sectors, the lack of family planning awareness, the increase in premarital sex activities, geographic isolation, and the lack of male involvement in family planning. For our final topic, let's talk about family planning during this COVID-19 pandemic. The enhanced community quarantine is an effective way to lessen the spread of COVID-19, but it also has a profound effect on the mobility of both family planning providers and clients. Some staff are unable to report for duty as public transport is currently discontinued, and the limited transportation also puts a strain on the delivery of FP commodities. These are just some of the common challenges that the health facilities are encountering as they work to continue providing these services. However, in spite of these challenges, a number of ways in which facilities are adapting and finding creative solutions to ensure continuity of FP services were identified and listed in the slide. These measures should be done with the observance of COVID-19 mitigation guidelines. The Department of Health and other related agencies also release some infographic materials on the things to do and the helpline numbers to contact for family planning during this COVID-19 pandemic. Before I end this report, let us remember that family planning is not a privilege, but a basic human right. By enabling women, particularly the most disadvantaged and the hardest to reach, to make informed choices about the number, timing, and spacing of their children, we help them exercise this right. Thank you.